This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. I'm Dave Wilson. Hope you had a great Thanksgiving weekend and hope you are ready to get your week started back in the office. Joining us this morning is the Mon Health Emergency Department Medical Director. We're going to be talking about Geriatric Emergency Department Accreditation. And Chris Edwards, the Medical Director for Mon Health Emergency Department, joins us on Mon Health Talk this morning. Good morning, Chris.
Good morning, Dave. How are you today?
I'm doing well. Did you have a nice Thanksgiving weekend?
Yeah, we did. Got all the Christmas stuff up. How was your Thanksgiving?
It was busy. I was on this job. Puts you on the road around the holidays a lot of the time. So got plenty of turkey, plenty of pumpkin pie. I covered all the pies, Chris. I got all the pies covered this past weekend. Pumpkin, pecan. Might have threw in a cheesecake for good measure in there too. So did you get all the leftovers taken care of?
Yeah, we finished those off last night. My daughter makes pumpkin logs, and we got through those, and so, yeah, I'm right there with you on all the desserts. All
right. Well, that's what we brought you on for. We were going to talk leftovers and desserts today, Chris. Thanks for stopping by. We are going to get into geriatric emergency, the emergency department, geriatric emergency medicine as well. But, Chris, remind folks a little bit about your background and what brought you to Mon Health.
I've been at Mon since 2007. I was born and raised down in Clarksburg. I did medical school at the osteopathic school in Lewisburg and my emergency medicine residency at South Point Hospital in Cleveland, and came back to the area because this is where I was from. And so I've been here, like I said, since 2007, been with Mon since 2007, and been the director at Mon since 2015.
What drew you to emergency medicine?
To be honest, no pager, no on-call. Initially, you go in, you work your shift, you take care of patients that come in, and you got to kind of go home and have a little bit of a life outside of it. Since becoming director, that has changed a little bit, but it's the mix of not knowing what's coming in, seeing different stuff every day, and the ability to kind of take care of them, sicker patients and try to make a difference.
Yeah, I would really have to use my imagination, Chris, because obviously never been in that situation, but you really have to be on your toes, and it's I would imagine a lot of quick thinking, a lot of quick decisions have to be made to save a patient's life in a lot of situations.
Yeah, it can go from 0 to 100 pretty quick. You could have a fairly normal day taking care of basic emergent issues to in a blink of an eye, switching gears and having someone in, cardiac arrest or respiratory arrest or, low blood pressures and that switch can get flipped pretty quick.
Well, the Mon Health Geriatric Emergency Department has been accredited by the American College of Emergency Physicians. Chris, that sounds great, but what does that mean?
It means that we meet certain parameters to get the designation. American College of Emergency Physicians has been around for a long, long time. It's our main body that the large majority of emergency physicians belong to. It's our main society. So it's kind of it's a big deal for us to be able to do this. Essentially, they set a list of criteria to make sure that we're taking care of our geriatric population appropriately. One of the really neat things I learned through the process was that we were doing a lot of it already, which made the journey to get the accreditation a lot easier. But essentially, we do special screenings for dementia or delirium for elderly folks. We make sure the medications are reviewed on admission to make sure no drug interactions. We actually have a system within our electronic medical record that also does that as we order medications. To little things, making sure we have large clocks so they're easier to see, make sure they have appropriate step stools so it's easier to get up into bed. We are actually looking at replacing all the flooring in the emergency department in the next year to make it all non-slip flooring. And all these upgrades were actually made possible by a very large donation, $350,000 gift from our Mon Health Medical Center Auxiliary, which we are beyond excited and appreciative to get that type of a donation.
It sounds to me, Chris, to put it simply, Mon Health is doing not only the things that are needed, but going above and beyond what's needed when it comes to taking care of older patients who are coming into the emergency department. Is that a fair, simple assessment?
Yeah, it is. There as we get older, there's a lot of special considerations that need to be taken in treatment, and we've really focused on that. Another part of the accreditation is making sure all of the nursing staff have some specific education towards the geriatric population. We have both nursing and physician education champions who do extra courses in geriatric medicine and the treatment of it to help out with the education with our other providers. So, yeah, it's a very important step for us.
We're talking to Chris Edwards, Mon Health Emergency Department Medical Director. And, Chris, when we come back on the other side of this break, want to get into some of the specific steps you take to treat patients who might come in with dementia and some of the other services for geriatric emergency services as well. We're talking to Chris Edwards, Mon Health Emergency Department Medical Director. We'll continue the conversation in just a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Emergency Department Medical Director Chris Edwards joining us this morning. We're talking about Geriatric Emergency Department Accreditation. And Chris, you mentioned when I asked what exactly that meant, that you have to do some things differently when older patients come into the ER. And let's get a little more specific, especially when it comes to patients who may be experiencing dementia. What are some of the protocols you have in place to handle them and make sure they get the attention and care they need?
So when patients come in, any patient comes in, they go through different types of screenings. We do everything from fall assessments, which goes into the geriatric population, to depression screenings across the board, which can also aid in elderly, as some do live alone and have family that are far away. Then we also added in the dementia screening, because sometimes the subtle signs of dementia will be there, but we just, in everyday life just don't recognize it. So it gives us the ability, when we do this screening upon, our nursing staff does this during triage, and when we are able to do this type of screening with something we may be able to pick up on that at an earlier stage, so that we can address it much earlier in the course of the disease process to try to help the patients out. So like I said, it's a set of questions that get asked at triage to all of our geriatric patients each time they come in. And if you meet certain scores, then certain other steps are followed in that process to help address and further on treat any type of dementia, early onset dementia that we're seeing.
And if a patient comes in, with the signs of dementia or the known case of it, they can be confused. It can be very disorienting for them, and it can make it more difficult for them to get the treatment they need, can it?
Absolutely it does. I mean, it goes from like I said, it can be very subtle, just simply, not remembering to take medications, which can play a role, not making it to appointments, which obviously plays a role in their health. So to catch it early, to be able to help address it with them and their primary care physicians, and more importantly with their family, so they have the appropriate help that they need, and we can watch any further progression is very important.
Talking to Chris Edwards, Mon Health Emergency Department Medical Director this morning. You also mentioned some of the medication considerations, and I was thinking back to some of my grandparents who had to make trips to the ER, and one of the first questions I can remember with my grandfather, not to him but my grandmother, because he had no idea, what medications is he on, because there was concern that a certain treatment could counteract a blood pressure medication he was on, or there were several of them. He had a cocktail of them at that point, Chris. But that's a consideration that when you're 75, 78, 80 years old, you may not have for a 30-year-old, and that's a very important step in the process.
No, you're absolutely right, and we do. We do medication screenings with all patients that come in, but it does play a lot bigger role as folks start using more and more medications. And the other challenge is that sometimes, and it's gotten better with electronic medical record, but some patients will see multiple doctors, and each of those places may not have that full list of medications. And like you said, you could be on a couple of blood pressure medicines and not realize it. Or when a new medicine starts and you're supposed to stop a certain medication and you don't, that can play a role in it. And then as we continue to get more advanced medications, they definitely have interactions with each other and older medications. And we obviously and very clearly do not want to mix those medicines and cause any adverse reactions with patients.
Chris, are there other hospitals other than Mon Health who offer these geriatric emergency department services like we've talked about?
So there are hospitals accredited all throughout the nation through ACEP. As of about 4 or 5 months ago, the only other hospital that was listed on ACEP's website was Berkeley over in Martinsburg. Other than that, we would be the only other geriatric accredited emergency room in the state.
Also, with the Mon Health Emergency Department, emergency room services, when we talk about patient safety, what are some of the steps taken as far as patient safety goes and accreditations there?
Well, patient safety is very, very important to us, and I know over the years we have gotten different awards as a organization, as a hospital, as a health system, through CMS and through Leapfrog and others. It's something that's at the forefront of what we think about when we take care of patients. Obviously, we want to address any medical emergencies that are occurring, but just as important is we want to make sure patients feel safe in our hospitals. They know that we're looking out for them. We know that we're trying to reduce things such as fall risk, the medication interactions, also to help with families, make sure it's a safe environment to be walking around the hospital, trying to reduce any, slip or fall issues throughout. So again, like I said, over the years, the hospital and the health systems received multiple awards for patient safety, and we are very proud of that, and it's something we will continue to do.
Chris Edwards, Mon Health Emergency Department Medical Director, joining us this morning on Mon Health Talk, and we'll continue the conversation right after this.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Chris Edwards, Mon Health Emergency Department Medical Director, joining us this morning. Chris, I got an advance copy of the schedule for next month. You're actually going to join us here in just a couple of weeks in December. We'll talk about the Mon Health Marion Neighborhood Hospital opening up in Whitehall. We'll get a lot more detail on that in your next appearance, but can you give us a little preview on how the opening's going?
It's moving along. It's very fast-paced. It's very exciting right now. We have an open house today from 1 to 5. We start our orientation processes for employees tomorrow, and we're rapidly approaching our open date of December 14th.
Can you even begin to give us an idea of what it takes to open a new facility like that? I would imagine that it has to be just a monumental undertaking.
It has been. It's been a tremendous learning experience for me, kind of following the folks that are really kind of getting the building up, all the ordering done. There's been a tremendous team at Mon and our partners at Ameris that have taken up this undertaking, done a tremendous job. A couple people at Mon specifically are Brian Smith and Josh Clovis that have done an unbelievable job getting things moving along, keeping on track, and being ready for this December 14th open date.
And got to be gratifying, too, to see it all starting to come together, knowing that here in just a matter of days, it'll be up and serving the community there in Whitehall.
No, it's very exciting. This has been couple-year type project, and to see it come into fruition is just a very exciting moment.
All right, we've been talking about Geriatric Emergency Department, the Accreditation, the Mon Health Emergency Department. Where can folks find out more information and learn a little bit more on some of the processes, procedures, practices going on right here in town?
On the internet, you can go to monhealth.com/emergency to find that information out about our emergency department, not only at Mon Health Medical Center, but our system hospitals with Preston Memorial Hospital, Stonewall Jackson Memorial Hospital. Those are, our folks in PR with Christina Adrian keep the billboards up and people informed about what's going on, and the newest and latest at Mon Health.
And this bears repeating. I think we mention this almost every week, Chris. If you do experience symptoms or, think something's a little bit out of the ordinary, whatever the case may be, don't put it off. Don't worry about, the pandemic. Don't ignore your health care, because that could cause you a whole lot of trouble down the road, and you might be able to catch something very early, and when it's very treatable. Go get checked out. Don't worry about it. Everything is in tip-top shape as far as your protocols, your safety procedures, all of that. At this point, it's probably just second nature to you now.
It has been. We're still continuing to wear our masks. Working all of our large percentage of our folks have already been vaccinated. We still in the emergency room and hospital to limit visitation to continue to protect folks with the pandemic. But no, you have chest pains, feel short of breath, signs or symptoms of stroke, get into your closest emergency room immediately at that point in time, and that's what we're there for.
Yeah, don't put it off. Chris and his crew will take care of you down at the Mon Health Emergency Department. Chris, thanks for stopping by here on a Monday morning, and look forward to talking to you in a couple of weeks about the grand opening of the Mon Health Marion Neighborhood Hospital coming in Whitehall. Good luck with the open house today as well.
Yeah, we appreciate it, Dave. Look forward to talking to you in a couple of weeks. Have a great rest of the holidays.
Will do. We'll talk to you again soon. Chris Edwards, Mon Health Emergency Department Medical Director. And again, more information, you can always go online to Mon Health's website, monhealth.com/emergency. And I would be remiss if I did not mention there's all kinds of content over at the Mon Health Facebook page. All right, that'll do it for this week's show.